February is American Heart Health Month, and as we near the 2-year anniversary of the pandemic, Americans are facing ongoing consequences to their health habits that may have had a negative effect on their heart health. Dr. Emanuel Finet with the Cleveland Clinic joins us now to talk more about this. Good morning, Dr. Finet. Thank you so much for being with us today.
Good morning. Thanks for having me in the program.
The survey that just came out from the Cleveland Clinic shows that 41% of Americans have experienced at least one heart-related issue since March 2020. We are coming up on 3 years there. So how has the pandemic affected heart health and healthy habits in particular?
Yes. As you said, a great proportion of patients have complained of shortness of breath, chest pain, dizziness, and high degrees of blood pressure, and those are indications of possible cardiovascular disease. Americans have lived more sedentary lives, and their eating has not been as healthy as it used to be, and we've also had higher levels of stress. So all those can have a negative impact in our heart health.
Let's talk a little bit about stress. According to your survey, women have felt more stress than men during the pandemic. Some of us have a few more responsibilities than others. So how has this increased stress attributed to heart issues?
That's true. Sorry.
It's okay.
70% of the women actually say that they have higher stress, and I think the part of it is like you mentioned, they have higher responsibilities at home, taking care of the children, working from home, homeschooling. Stress is a negative factor for cardiovascular disease. It increases high blood pressure. It leads to eating more and generate obesity, can lead to palpitations, heart attacks, and even cardiomyopathies due to stress, which it can cause heart failure. So we have to get it under control.
Can all these levels of stress impact somebody's heart health, even though that person does not have heart health issues in the family?
Yes, certainly all those are risk factors in the general population, and those that have a family history of cardiovascular disease is even more impactful.
A lot of people who do have a history of heart disease, according to your survey, it found that less than 40% of people with a family history have decided to get screened. Do you think this is because they feel that there's really nothing they can do to limit their risk of developing that condition?
Yes, that's what it seems, which I think is based on misinformation, really. 80 to 90% of cardiovascular diseases are preventable, even in those patients that have family history, because many of that family history is really family history of the risk factors that lead to those diseases. So it is important to get screened and to take control of our health by managing our blood pressure, controlling blood sugar, controlling cholesterol, eating healthier, more exercise, weight loss, and of course, stop smoking. So those are the key elements of a healthy lifestyle.
Dr. Emanuel Finet, before we say goodbye, where can our viewers get more information to make sure they're taking the proper preventative steps?
Yes, they can definitely go to our website, clevelandclinic.org/loveyourheart, and you'll find information there and educational materials as well.
All right, Dr. Emanuel Finet with the Cleveland Clinic, thank you so much for joining us today, sir.
It's been my pleasure. Thank you.